Dr. Eshkevari, I'd love to hear what lights you up about this work. Why do you do what you do in the ketamine therapy space?
Oh, that's such a great question. Thank you for asking it. I'll be honest with you, I've had personal experience with mental health. Um, Someone very close to me, a family member, struggled pretty much her whole adult life with depression, anxiety, chronic pain due to Lyme disease. So all of these things, having to deal with a family member who was so very close to me, dealing with all of these issues that really did compound one another, where there was really no good medications or therapeutics for them, that I think really led me to take this on as much more of a personal um, journey, if you will, than I think the average healthcare provider. I really do. I think having a family member that has suffered for a very long time and has had no real good relief from current medications or current regimen really led me to take this on as wholeheartedly as I have.
You were one of the first ketamine providers in the Washington, D.C. area. Tell us a story about how and when you started Avesta.
Sure. So I think, as you know, I was a full-time professor at Georgetown University, and this is going back about 6, 7 years ago. And I was already teaching the pharmacology of anesthetic agents, one of which is ketamine, to medical students and graduate nursing students. And at the time, one of my colleagues asked me if I'd heard about ketamine and its impact on mood disorders. And my response to her was, of course I have, because every year as you update your lectures as a professor, you add in more and more of the most recent research. And so as I was adding these new research studies to my PowerPoint lectures, I became more and more familiar with the protocols and what was really being done in this space. It was interesting, but also was a good way of teaching students about an off-label use of yet another medication that was found to be useful, an anesthetic that was found to be useful in mental health. So that colleague and I ended up working together to open a ketamine clinic in the area. It was the first ketamine clinic actually in the DMV area. And then what happened was, my partners wanted to take that clinic in a very different direction, more on the wellness side than the medical uh, pain management side, if you will, of ketamine. And so we parted ways amicably, obviously. And then I decided to open Avesta and really take care of mood disorder and chronic pain patients. So that's how the whole idea came about.
Amazing. For those of us who don't know, can you tell us what makes someone qualified to be a ketamine provider?
That's actually a really good question. And I'm so glad you asked because, there's always a debate uh, over the last decade, like who should own the ketamine space? Should it be mental health care providers? Should it be psychiatrists? Well, first of all, it has to be someone that has prescriptive authority, right? So someone that can actually prescribe the medication. So now there are lots of different models and ideas. Should it be a psychiatrist? They're physicians, they can prescribe ketamine. They also know the mental health side. So maybe that's a good provider. Or is it better if it's an anesthesiologist or a nurse anesthesiologist who also has prescriptive authority, but they understand the side effects and the dangers of using a drug like ketamine, and then collaborating with a mental health care provider? Or is it better if that psychiatrist or mental health nurse practitioner is taught how to manage some of those really dangerous side effects and they're the best prescribers? So, there's always this debate of, where does ketamine belong? And my idea is, ketamine is a drug. It's a useful drug. It's useful for so many patients. I mean, we have honestly in the age range of 18 to 65, even in our own research study, we found that, there was an 80% efficacy rate. So why would we want to pigeonhole this drug and say, oh, it belongs only to anesthesia providers, or it only belongs to mental health care providers. I think the more people that can increase access to this type of care, but as carefully and as safely as possible, I think they're the providers that should be doing it. So in my opinion, the short answer is it should be someone that understands how the drug works, the pharmacokinetics and dynamics of the drug, what happens to the drug in someone's body, and what are some of the worst things that can happen. This is an anesthesia mentality. What is the worst thing that can happen with this drug? And whatever that worst thing is, am I qualified and able to handle it? If the answer is yes, then you can safely do ketamine for patients. If the answer is no, then I think you do need some additional training in order to get you to that point. And then for the anesthesia providers for whom the answer is always going to be yes, I know how to handle the most untoward side effects. Those providers, I think, should have some collaborative agreements or relationships with mental health care providers in their community, because this isn't a drug that works in isolation. It works best with therapy, integration therapy or ketamine-assisted therapy, and all of those require a different skill set than anesthesia providers can support.
Awesome. Okay, that's very helpful to understand.
And I want to let you know, as an aside, that there is the dog, and she's very special, and she does roam and drink her water. And so just to be mindful that, she's the star of the show.
We love Shelly. Okay. Help us understand Avesta's core values.
Oh my God. Honestly, I think the biggest value behind what we do is patient-centered care. We put the patient at the center of everything that we do, and we really, really try to individualize the patient's plan. Some people come in, they've had years and years of therapy, and they start out saying, look, I've tried therapy, I've tried medications, none of it works. I do have a prescriber, but I don't want to deal with therapy. Even though we say, hey, this is the best way it'll work, that's all they want. They want to come in, they want to do the ketamine, they think that's what is going to really help them. And we don't judge, we cater to that person. We do have other patients that come in and they might need a lot more support. They might need some initial coaching, getting them in the right mindset, especially patients who are very anxious. They might benefit from a couple of sessions of anxiety, kind of really how to manage their anxiety, how to really get in the right headspace, and then how to integrate. So I think if you ask, what's the value, what's the best value that we incorporate and have for our patients or bring to the table, is patient-centered care. Put the patient at the center of everything we do, and then individualize the plan for that patient.
Do you follow a standardized ketamine protocol, or is each patient's treatment plan tailored to their needs?
That's a really good question. So, some of it is, we kind of have to come at it from a two-pronged approach. The first, I think what makes the most sense initially with any patient is, hey, what has the research shown? What's the evidence-based practice that we really want to, basically bring on to this patient, and what's research shown to work the best? So we have a two-pronged approach. The first is that we put everyone through our initial induction phase. That's pretty standard. We now have a really strong body of evidence that shows that, if you do ketamine twice or 3 times a week for 2 to 3 weeks for a total of 6 treatments, some people might need a 7th or 8th, but generally speaking, that initial protocol is pretty standard. The dosing might vary. That's very individual, anywhere from 0.34 milligrams maybe per kilo, depending on the patient's age, to 0.5 milligrams per kilo, to maybe 1.5 or 2 milligrams per kilo. Somewhere within that range, that 2 to 3 times a week over 2 to 3 weeks is kind of standard protocol, if you will. That's what research has shown works the best. But then from there, that's the second part of the treatment where we really do individualize it, where we taper patients off slowly. We provide different dosing. We might start to talk to the patient about adding exercise, really, really simplifying and yet adding more foods to their diet. I always tell patients, eat foods of every color. Try to incorporate, if radishes are in season, incorporate red radish, incorporate orange, incorporate yellow bananas, orange pumpkins, so you really leafy, green vegetables. So we talk to patients about kind of a cadence of how they should come back, for how and when they should come back for their ketamine treatment. But even more importantly, how to sustain the new neurons that we've grown. How do you maintain this on your own so that you're not really relying on us? We don't want patients to be on lifetime ketamine therapy. And in fact, in our clinic, we're very adept at getting people to the point where they only come back for boosters or not at all. They're doing so well with their own therapy, with their own regimen, that they don't need to come back. So I think those are the things that are really important when you're doing the practice. Is there standard protocols? Yes. But are there opportunities to individualize the plan? Absolutely, 100%.
Do certain types of patients see higher success rates from ketamine therapy than others?
Yes, absolutely. So, unfortunately, patients 18 to 65 are kind of that sweet spot. I think sometimes when people are a little older, unfortunately, their brain is not neuroplastic enough. So I would say the ideal patient, although our youngest patient now I think is 15, our ideal patient is somewhere in that, late teen, early 20s, all the way to around 65, maybe 70-year-olds. But after that, I think the brain is less neuroplastic. And then I think the people that really get the most out of the treatments are people who really dedicate. They come in and they're like, I'm going to dedicate, I'm not going to build, ketamine around my life. I'm actually going to dedicate the next month, coming in twice a week for 3 weeks, doing ketamine assisted therapy or integration therapy in between, really starting to change my diet, really eating a little healthier, just taking general better care of myself, and exercising. And by exercising, it means that once people are more functional, people who actually take it seriously and say, okay, I'm going to start going for a walk, even if it's a block one day, 3 blocks, a month later, 5 blocks the following month. So I think it's people who really take it seriously and really start to build their life around their own selves. That self-care becoming at the core of everything, and really beating down the negative talk, the negative internal talk, the ruminations, some of the ideations that people with depression and anxiety tend to have. Once we can really help those with ketamine, then if the patient is truly dedicated to a wellness regimen of taking care of themselves, I think they're the ones that benefit the most.
What is your advice for patients who don't respond well to ketamine? What options do they have for effective healing?
Yeah, that's always so disappointing and such a letdown, right? Because here's this great therapy. Now, lots of news media. I think there was even on Channel 4 News recently, or on the Today Show, there was a few months back, a couple patients who talked about what a positive change ketamine had brought for them. So I think when there is so much in the news media now about ketamine and some of these alternative, mind altering psychedelic therapies that work so well for patients, I think when it doesn't work for one individual, it can be really disheartening and really disappointing. But, I think, there are always other therapies that people can try. Obviously, by the time people come to ketamine, they've tried all the medication regimen and all the different types of classes of drugs. But, maybe that patient could benefit from, some intensive outpatient program, or even an intensive inpatient program where they can really start to, again, put the focus on their own care, not giving in to the ruminations or the negative thinking, maybe trying a different modality, maybe TMS, maybe even psilocybin. There are some studies currently ongoing. If patients go to trials.gov, I think they can find, clinical trials that are now accepting patients for psilocybin therapy. So I think there are other things that are coming, MDMA therapy. There are other newer drugs that are also coming along that I think patients could maybe try if something like ketamine doesn't work. So there are lots of options out there, and I always advise patients, if the ketamine doesn't work for you, please confer with your psychiatrist or mental health nurse practitioner to kind of figure out what else you could try. And a lot of providers are very adept at signing their patients up for research studies. And so those are some of the things that can be done.
Let's switch gears and talk about Avesta. Tell us how you choose your team and the training that they undergo to provide the highest level of ketamine care.
Yeah, that's a really great question. So, a lot of clinics use patient care technicians, which are wonderful, amazing healthcare providers. But in our clinic, we find that it's really useful to have people who have college degrees, specifically not just college degrees, but college degrees with undergrad specialties in sociology, psychology. People who really have always had the human mind as an interest point, right? So once you have those people that are all coming together from the same almost mindset that, hey, I've always been really interested in mental health. And so I studied sociology, I studied psychology in college. So those are kind of the providers that we like to use as our medical assistants. So all of our medical assistants hold 4-year degree college degrees, mostly in the psychology, sociology fields. And then as far as our hands-on healthcare providers, licensed healthcare providers, again, we really admire nurses with undergraduate degrees or RNs. We think that they provide a lot of very valuable healthcare to the population at large. But in our clinic, we really want advanced practice nurses. We like the nursing model. We do not use physicians very much. We do have our main collaborator is a physician, Dr. Belamowicz, who is phenomenal and amazing, has over 30 years under her belt of anesthesia practice, who we work very well with. But generally speaking, we want our healthcare providers to come from the nursing model, because that model really isn't about the disease. It's much more about wellness and the health of the patient. And all of our nurses have a background as emergency room nurses to begin with, or intensive care unit nursing, or infusion nursing. And the reason being that these nurse practitioners that have advanced practice training at least come to us with the basics of monitoring a patient. How do you monitor heart rate, blood pressure? Some of those things that we spoke about earlier, some of the things that can go wrong when doing ketamine, even though it's a very safe drug. Our nurse practitioners are really adept at handling those situations. And then on top of that, they have advanced practice degrees. Again, in that nursing model where they come at the patient holistically. And what we do is we train them on the pharmacokinetics and dynamics of ketamine. We talk about ketamine infusions, the dosing. We talk about getting patients in the right head space, if you will, for going into the journey. And then now we're working towards bringing some mental health colleagues to help our nurse practitioners understand how to bring people out of the journey as well, to help them at least when they're coming out, kind of in that acute phase of between ketamine and reality, if you will. How does the nurse practitioner interact with the patient so that they can anchor some of the things that came up during that ketamine session, so that they can take it to their integration therapy session with a mental health care provider, whether it's their own therapist or it's one of our integration therapists. So we really do take it very seriously. Who is at the boots on the ground, if you will, with our patients, and they have to be people that really at the end of the day have a mindset of mental health being a true interest of theirs. And then the additional training that we provide.
Fantastic. Dr. Eshkevari, that was so lovely. Thank you so much for your time today.
Thank you so much for having me and for this conversation. I really appreciate it.